Today we're discussing Gradenigo Syndrome, a rare but serious complication of chronic ear infections. Gradenigo Syndrome is characterized by a triad of symptoms caused by the spread of an ear infection into the petrous apex of the temporal bone, leading to inflammation and infection that affects nearby cranial nerves. The triad of symptoms includes persistent ear discharge, or otorrhea, due to chronic middle ear infection, deep facial or retro-orbital pain, typically due to trigeminal nerve involvement, and Abducens nerve palsy, resulting in double vision due to weakness of the lateral rectus muscle. The infection spreads from the middle ear to the petrous apex, an area close to cranial nerves, which can lead to petrous apicitis, causing symptoms like pain and nerve palsy. Common causes include chronic suppurative otitis media, mastoiditis, and bacterial pathogens, mainly Pseudomonas aeruginosa and Streptococcus pneumoniae. Diagnosis involves a clinical examination to look for the classic triad of ear discharge, facial pain, and Abducens nerve palsy, along with imaging such as CT or MRI scans to detect infection of the petrous apex, assess the extent of bone involvement, and identify any nerve compression. Treatment typically involves high-dose 4 antibiotics to target the infection. Surgery may be needed for drainage or decompression if the condition doesn't respond to antibiotics. Pain management is also essential, particularly for trigeminal neuralgia. Complications can include meningitis, persistent cranial nerve deficits, and intracranial abscess. In conclusion, Gradenigo syndrome is a critical condition that requires prompt diagnosis and aggressive management to prevent severe complications. Always consider this syndrome in patients with chronic ear infections presenting with facial pain and eye movement abnormalities.